Today I am going to interpret a book, Poor Economics, a radical rethinking of the way to fight global poverty. Many people may be thinking poverty is not having enough to eat and not being properly clothed. The World Bank has set a benchmark for extreme poverty, defining it as one person living on less than $1.90 per day. Such money can cover 3 meals a day and essential items such as healthcare, education for children, and more. It may be difficult to imagine, but the population of extreme poverty truly exists and is vast. As of 2020, approximately 730 million people lived below extreme poverty. These impoverished populations are primarily concentrated in Asia, Africa, and Latin America. Over the past few decades, countries and charitable organizations worldwide have provided them with financial aid, food, medical assistance, and other forms of support. However, these impoverished populations have not managed to escape poverty. For instance, in sub-Saharan Africa, where the most significant proportion of impoverished people resides, the poverty rate was 55.1% in 1990 and still stood at 40.4% in 2018. Why hasn't aid been more effective? Should we continue assisting them? These questions have been the subject of ongoing debate within the international community. To address these issues, 3 economists, Abhijit Banerjee and Esther Duflo, a husband and wife team from MIT, and Michael Kramer from Harvard University embarked on over 240 experiments in poverty-stricken areas across 40 countries starting in 2003. Their research findings revealed that impoverished individuals' struggle to escape poverty is often due to their inability to make informed decisions regarding health, education, money, and other poverty-related issues. This inherent difficulty in decision-making is at the root of their persistent poverty. For their groundbreaking work in using experimental methods to alleviate global poverty and significantly enhancing our ability to combat poverty worldwide, these 3 individuals were awarded the Nobel Prize in Economic Sciences in 2019. The author of this book is Abhijit Banerjee, along with his wife, Esther Duflo. They have compiled the research findings of their team into this book, which consists of 10 chapters. Through a wealth of experimental data, the authors reveal how impoverished individuals make decisions related to health, economics, education, and work, and they explore practical ways to assist them in improving their circumstances. I will help you understand this book through 2 questions. First, what is the essence of poverty? Second, how can we help impoverished individuals escape poverty? Let's start with the first question, what is the essence of poverty? In other words, why are some people poor? The authors describe the situation of poor people as a poverty trap. What does that mean? Imagine a person who earns $20 today. After deducting the $18 necessary for food expenses, they have $2 left. If they make $22 tomorrow, again removing the same $18, they can save $4. By gradually increasing their income, they can save money and escape poverty. However, if a person earns only $17 the next day, they must use $1 from the $2 they saved the previous day to cover the $18 expenses. Over time, they will find it increasingly difficult to make ends meet and become even poorer. The authors refer to this situation where tomorrow's income is consistently lower than today's, and people cannot break free from this cycle to improve their income levels as the poverty trap. But why can impoverished individuals earn less and escape the poverty trap? It's not because they are lazy or unintelligent. The authors discovered that they often need help to make the right decisions regarding health, education, money, and other poverty-related issues due to their limited environment, lack of necessary knowledge, constrained thinking, and poor decision-making abilities. Here's an illustrative example. Many poor individuals make a living by running small businesses, such as vegetable vendors in Chennai, India. They purchase vegetables worth around $20 from wholesalers daily but need the $20 capital. Instead, the wholesaler lends it to them. By evening, they sell the vegetables for $22, pay back the $20 capital, and return an additional $2 as interest to the wholesaler. In the end, they earn $2 profit. However, borrowing $20 daily with a daily interest rate of 4.7% is costly. You might wonder why these vendors don't save up to $1,000 to invest in their businesses, thus avoiding the daily interest payment. The answer lies in their spending habits. These vendors spend $5 daily on small luxuries, such as 2 cups of tea. If they cut back on these expenses, they could save up the $1,000 needed for capital within 50 days, thanks to compounding. However, the vendors need help to save the extra money. They don't believe that saving these small amounts can significantly change their lives, and they find it hard to exercise long-term self-control to forego daily comforts, even though it would lead to a doubling of their income in the long run. In this case, helping them save $1,000 doesn't guarantee a permanent improvement in their income. Instead of using it as capital to grow their businesses, they often divert the money to address immediate needs, such as healthcare or buying school books. This short-term focus keeps them trapped in poverty. So, why can't they save money to improve their business? On the one hand, they don't see the value of small savings, given the multitude of challenges they face. On the other hand, maintaining long-term self-control requires considerable effort and resilience, which they find challenging. The author's research demonstrates that impoverished individuals face objective and subjective reasons for their poverty. While external factors, such as harsh environments and insufficient initial capital, play a role, the internal factors, including limited knowledge, psychological constraints, and decision-making challenges, are equally important. For governments and charitable organizations, this research offers valuable insights. It shows that simply donating money may have short-term effects but may not lead to a lasting change in impoverished individuals' circumstances. Additionally, efforts to promote low-interest loans need more support from banks. Therefore, the authors provide a methodological framework that offers genuinely effective ways to help impoverished individuals. 1. Understand the situations and decisions of disadvantaged individuals through experiments and observations. 2. Analyze the decision-making psychology behind their behaviors. 3. Develop practical solutions to assist them. By having this methodology, we can better help impoverished individuals in ways that genuinely make a difference in their lives. The second part will discuss what specific measures can be taken to help people experiencing poverty. The author believes that the factors causing people to fall into the poverty trap can be categorized into 4 major areas: money, health, reproductive issues and education, and uncontrollable risks. Now, let's discuss each of these factors one by one. The first factor is money. Poor people are often misunderstood as those who don't have enough money to eat. People believe that because they are poor, they lack the energy to work, and because they can't work, they can't earn money. Therefore, governments and the international community provide a lot of food aid to impoverished areas. For example, in 2008 to 2009, Egypt spent $3.8 billion on food subsidies, accounting for 2% of Egypt's GDP that year. However, you may be surprised to know that much of the food ends up in the stomachs of rats. Data analysis by the author's team shows that even people in extreme poverty are not starving. Surveys conducted in 18 countries revealed that food consumption accounts for only 36% to 79% of total spending for the extremely poor in rural areas. In other words, no absolute food shortage exists for those who need help to afford it. Since they spend only some of their money on food, where does the remaining money go? Do they save it or buy more nutritious food to improve their health for better labor participation? The answer is that poor people can't save money. When they have some extra money, they buy more enjoyable and expensive food items rather than more or healthier food. For example, if their staple food is corn, theoretically, they should buy more corn or nutritious items like eggs if they had extra money. However, they often spend their money on sugar and tea, indulging in enjoyable foods. In today's terms, they engage in consumption upgrades when they have money. The author's team also observed that poor people believe things are more important than food, such as marriage, funerals, and weddings. Poor people spend a lot of money on such occasions. In South Africa, a funeral for an older adult could cost $825, roughly 40% of a family's annual income. After such an event, the family has little savings left, and more family members may need more food, leading to children dropping out of school. Another example is that television is sometimes considered more important than food. In a remote mountain village in Morocco that the author's team visited, people lived in houses without access to clean water and poor sanitation. Adults tried to earn money to buy food, but most households had television sets and DVD players, and some even had mobile phones. Poor people earn money and don't actively invest in making money. As mentioned earlier, the Indian vendor who doesn't want to save 5 rupees is not an exception. This is a common characteristic of poor people. For instance, using fertilizers can significantly increase crop yields and income, with data showing up to a 70% net profit increase. However, in Kenya, only 25% of farmers use fertilizer yearly. The reasons are similar to those of the Indian vendor. Most farmers spend their money on other household expenses during the planting season and can't afford to buy fertilizer later. Based on this analysis, the author proposes 3 recommendations. 1. Since poor people do not lack food, there is no need to provide food aid to everyone. Governments and the international community can shift their focus to ensure the nutrition of children and pregnant women to improve the population's overall health. 2. Provide a mechanism that allows people to save money. Allow poor people to save money in advance and withdraw it when needed. For example, the author's team initiated a program to pre-purchase fertilizers. After the harvest season, they immediately offered discounted fertilizer to farmers, delivering it when farmers needed it. This program locked farmers' funds into fertilizer, and the number of farmers using fertilizer increased by 50%. 3. The international community should offer poor people more options for small-scale loans. The renowned Bangladeshi economist Mohammed Yunus established a microfinance bank that explicitly lends to low-income people. The average annual interest rate charged by microfinance banks is around 25%, higher than traditional bank lending rates, but much lower than the interest rates typically paid by small vendors. Microfinance banks operate in 2 main ways. They primarily target female entrepreneurs because they are considered more responsible and have a more vital willingness to repay loans. Secondly, they lend to groups where each member is jointly accountable for the debts of others. Group members meet weekly, report on their business progress, and repay part of the loan during these meetings. This approach effectively uses peer pressure to reduce default rates. Yunus received the Nobel Peace Prize in 2006 for his work. After discussing the money issue, let's look at the second significant risk that leads poor people into the poverty trap: health problems. Statistics show that in Indonesia, if a family member falls seriously ill, the family's consumption level can drop by 20%. However, the author has found a common phenomenon in impoverished areas: people are willing to spend money on treatment. Still, they are unwilling to spend small amounts on prevention. Vaccination is a representative example of prevention. Many diseases, such as chickenpox and pneumonia, can now be prevented through vaccination. In a poor area in India called Udaipur, the author's team found that the childhood vaccination rate was only 6%. It is estimated that 2 to 3 million people die each year from vaccine-preventable diseases. Diarrhea, a common illness in impoverished areas, is a prime example. Approximately 1.5 million children die from diarrhea each year, with most of these cases occurring in South Asia and Sub-Saharan Africa. The leading cause of diarrhea is consuming contaminated water, which can be easily prevented by adding chlorine disinfectant, costing only 18 cents, to household wells to purify the water. Drinking clean water for a month can prevent diarrhea. Additionally, dehydration is a significant factor leading to death from diarrhea. An oral rehydration solution, ORS, made with sugar and salt can effectively prevent dehydration. However, statistics show that in Zambia, less than 10% of people use chlorine disinfectant, and many find it challenging to use it consistently monthly. According to UNICEF data, only 1/3 of children under 5 with diarrhea received ORS. So, why are poor people unwilling to vaccinate or buy chlorine disinfectant? The reasons behind this are complex. Firstly, the quality of service in local public hospitals could be better, and absenteeism among doctors and nurses is common. A survey by the World Bank in 2002 to 2003 in countries like Bangladesh, Ecuador, and India found that the average absentee rate for doctors and nurses was 35%. Many villages in these areas are located in remote mountainous regions, and people may hike for hours to get to a vaccination center only to find that the nurse didn't show up, forcing them to return home. Even when doctors are present, they often prescribe medication without a thorough examination, leading to patient distrust. Secondly, poor people need more adequate knowledge and information. Without access to reliable sources of information and a limited understanding of health and vaccines, they may not fully grasp the preventive benefits of vaccines. They may think their children are currently healthy and, therefore, do not need vaccination. Additionally, vaccines are particular. For example, the measles vaccine can only prevent measles, but no other diseases. It leads to confusion when they see their vaccinated children still falling ill, causing them to lose faith in vaccines. Thirdly, the decision-making process regarding vaccination or water treatment requires constant self-control and commitment. For instance, when health workers introduce vaccines, parents must assess their effectiveness. They must also overcome immediate difficulties, such as taking their children for vaccination. Similarly, adding chlorine disinfectant to a well every month can be challenging, even for the average person. In response to health issues, the author suggests several recommendations. 1. Improve public hospitals' management and service quality to provide more accessible healthcare to people experiencing poverty. Regulate the qualifications of private doctors and control the sale of antibiotics to prevent overuse and antibiotic resistance. 2. Provide more convenient access to healthcare for people experiencing poverty. For example, the author's team stations specialized medical teams in villages to offer free vaccination services, increasing the vaccination rate from 6% to 17%. 3. The government should offer default options to low-income people, reducing their need to make decisions. One of the most effective methods in impoverished areas is to provide free chlorine disinfectant and place the chlorine release devices directly by water sources in densely populated areas. Public investments in these regions' water supply and sanitation facilities should also be initiated promptly. Additionally, providing free medicines and nutritional supplements to school children, with suitable incentives, can be a practical approach. For example, the author's team not only stationed medical teams in villages, but also provided incentives to those who came for vaccination. Each person vaccinated received 2 pounds of beans, and if they completed all 5 shots, they received a set of dishes. This approach increased the vaccination rate from 17% to 38%. These recommendations aim to address the complex challenges of healthcare access and prevention in impoverished areas, ultimately helping poor people improve their health and break the cycle of poverty. Next, let's examine the third factor that keeps poor people trapped in poverty: fertility and education. If poor people have fewer children and provide them with a good education, these children are more likely to find better jobs and earn more money, which can help them escape the poverty trap. However, what is the reality for poor people? Firstly, the poorer people are, the more they tend to have children. For example, the total fertility rate for women in Ethiopia is 6.12 children per woman. The core reason for this is having children as a form of old age security. Since the government cannot provide adequate retirement support, people rely on having more children to ensure financial support in old age. Having children is also an economic investment because parents still determine which child will provide for them. So, having more children increases the chances of having one who can support them. However, due to extreme poverty, parents may invest less in each child regarding food and educational resources. This can lead to a situation where, in a large family, only one child receives an education, and all the hopes and resources are concentrated on that child. As a result, other children in the family may be neglected. Dropout rates among children in impoverished areas range from 14% to 50%, and many of these dropouts are voluntary, with children deciding not to continue their education. So, why do children in poverty-stricken areas often choose to drop out of school? The reasons are multifaceted. Firstly, the high absenteeism rate among teachers in these areas is a significant issue. Teachers frequently miss classes. For example, in Bangladesh, Ecuador, India, and other countries, teachers are absent an average of 1 day every 5 days. Secondly, the quality of education in public schools in impoverished areas could be better. During the author's team's visits to various impoverished regions in India, testing was conducted on over 1,000 children aged 7 to 14 in several villages. The results revealed that 35% of the children couldn't even read a simple paragraph at the first grade level, and 70% couldn't solve second grade math problems. The problem primarily lies with the education system in schools, which aims to identify the most talented students and tends to disregard those with poor academic performance. Poor parents also need more motivation to invest in their children's education, believing that it won't lead to better job prospects in the future. To address the issue of high fertility rates and improve education, the author suggests the following measures. 1. Implement population policies that make people feel less compelled to have many children, especially sons. This requires the government to establish effective social security systems, such as health insurance or pension schemes, to ensure people don't rely solely on their children for support in old age. 2. Change the educational goals in impoverished areas by simplifying the curriculum and making it more accessible for children to acquire basic knowledge, such as reading and arithmetic. If children face difficulties in learning, they should be allowed to repeat a grade. 3. Modify the approach to aid programs. Instead of donating textbooks to impoverished regions, consider recruiting volunteers to provide free tutoring during school breaks. This approach has proven effective in helping children improve their reading and essential math skills. 4. Implement distance education programs to mitigate the issues of poor teaching quality in local schools, making education more accessible to a broader range of children. 5. Encourage parents not to invest in one child's education selectively but to ensure that all their children acquire basic knowledge, which will benefit the entire family. These recommendations aim to address the challenges related to high fertility rates in education in impoverished areas, ultimately helping poor people improve their prospects and break the cycle of poverty. Why do poor people have such poor resilience to risks? The author analyzes 3 main reasons. 1. Inadequate responses to risk. When risks occur, how poor people respond to them is often problematic. For example, if someone works as a laborer on a construction site and the site shuts down, leading to unemployment, their response might be to increase their workload by seeking work on other construction sites. However, when the overall demand for construction projects decreases, more laborers compete for jobs, which drives down wages. So, their response to risk increases the labor supply, leading to lower wages. 2. Lack of insurance. Poor people often do not invest in insurance to mitigate risks. This is partly due to their limited understanding of insurance and skepticism about its value. Additionally, from the perspective of insurance companies, poor people are seen as high-risk clients with low policy amounts, making them less attractive to insure. As a result, when natural disasters or severe illnesses occur, there is no insurance to help poor people manage these risks. 3. Physiological factors. Long-term poverty generates significant stress, releasing stress hormones like cortisol. These hormones can affect certain areas of the brain, especially the prefrontal cortex, which plays a crucial role in impulse control. As a result, individuals living in poor conditions are more prone to impulsivity and anger. Based on this analysis, the author offers 2 main recommendations. First, emphasize the importance of insurance. The government should provide primary insurance coverage, such as subsidizing crop insurance for farmers and offering basic health care coverage to all citizens. These measures would help provide essential financial security to poor people. Secondly, promote stable employment. Stable employment is crucial for poor people. Creating opportunities for stable jobs, such as by attracting factories or recruiting workers, can give poor individuals a sense of control over their futures and make them more willing to invest effort in improving their lives. In summary, poverty is more than just a lack of money. It can erode an individual's ability to tap into their potential and diminish hope for the future. Therefore, addressing these issues related to risk resilience is essential for breaking the cycle of poverty.